Hi all, myself Deepika from the Department of Radiography and Imaging Technology from SNS College of Allied Health Sciences. Now I'm going to discuss about Dual Energy X-ray Absorptiometry, which is also known as DEXA scan in the radiology department, and also called as BMD test, which is bone mineral densitometry test. Coming to the introduction part, DEXA is also known as Dual Energy X-ray Absorptiometry, as I already told. DEXA scan is an instrument which is used to measure the density of the bones. So, to measure the density of the bone, we'll be taking this test, and the patient who is affected with osteoporosis, osteoporosis in the sense decreased bone mineral density, possibly due to menopause, malnutrition, and various other factors, and evidence of vertebral abnormalities, long-term steroid use, hyperparathyroidism, people with bone disease, lymphangiomatoses, which is children with a complex lymphatic anomalies, and lymphangiomatosis, which develop fluid filled cyst called lymphangiomas in the lymphatic system. And these non-cancerous cysts can grow into dangerous, and the immediately the test should be done. So these are all the indications for the DEXA scan. The next is contraindication. If it is not performed in pregnant women unless there is an urgent medical reason. So mostly it is not performed in pregnant women. Either alternate modality is chosen in the pregnant women. Hence, it is a radiation related modality. Patient preparation is all metallic objects in the body are removed, and the hospital gown is weared. Technique in DEXA scan, the photons are produced from low dose energy source. Two X-ray beams with two different energy peaks are passed to the patient. One peak gets observed and by the soft tissue, and other by the bone. So it generates two-dimensional image. Soft tissue is subtracted from the total area, giving bone mineral density. These measurements are then composed with the normal ranges matched for chronological age, which is by T and Z score. The scan usually takes about 10 minutes. T score shows the amount of bone that is compared with a young adult of the same gender with a peak bone mass. T score is used to estimate the risk of developing a fracture. A T score above -1 is considered as normal. Between -1 and -2.5 is considered as osteopenia, and -2.5 below -2.5 is considered as osteoporosis. So, is score? Is score shows the amount of a bone which is compared with other people in your age, same age group, and the same size and the gender. Is score mainly diagnose the risk of having fracture. The benefits of the DEXA scan is quick and non-invasive procedure. No anesthesia will be required for the study, and accurately measures the fracture risk. Less radiation exposure to the patient. Here is the difference between T score and the Z score. So, as I already told, T score, which compares your results to a healthy young adult of 20 to 35, and Z score compare your results to a person of the same gender and the age as yourself. Minus 2.5 to minus 1.5 to minus 2.4. It is also known as osteopenia, and less than 2.5, less than minus 2.5 will be considered as osteoporosis. So the main indication for these two studies is osteoporosis and osteopenia. So here is the graphical representation of the DEXA scan report showing a green signal as normal, which is above -1, and -1 to -2.5 is considered as low bone mass, and below -2.5 is considered as presence of osteoporosis. Next, here is also another image showing osteoporosis, normal, and osteopenia, and this is how the modality will be there. Patient will be lying on the couch, and the X-ray tube is will be in like in L shape, to maintain the position of the patient properly, and to immobilize, and to make the spine straight. We'll be keeping immobilization device under the buttock to keep their legs on it, so that the spine will be straight, and also to attain the stability. This is how we'll be getting the image in the DEXA scan. The common site of DEXA scan is L spine and the hip joint. So we'll be measuring density of the bone by using the common site, which is L spine, which is lumbar spine, and the hip joint. We'll be getting graph as like shown in the image. Thank you.